Right, if you have read and understood, kindly begin your station.
Hello, I'm
Hello.
Farah.
Hello.
Hello.
Yeah. How can I help?
Hello, I'm Farah, a senior house officer working for Mr. Mann. I'm calling to speak to Mr. Max to inform him about a patient with second post-operative day who underwent mastectomy with axillary clearance. Could I check that I'm speaking to
Yeah, I'm
Mr. Max?
speaking. Yeah, go on. I'm listening. Go ahead.
Okay, thank you. Elderly lady who is on the background of the COPD and the left ventricular failure had mastectomy with axillary clearance 2 days ago for breast cancer. Now she's having an axillary swelling and also she has experiencing shortness of the breath. So another problem is that her daughter wants to take her home, which is about 60 miles away. And I spent 20 minutes unsuccessfully to persuade her daughter to discharge today, but they will not, that it's not in her best interest. So,
Are you concerned about the patient?
yes, I'm concerned about the patient.
What are your concerns?
My concern is that she has having an wound swelling on her axilla, and also she's facing the shortness of the breath. And
Okay.
she's also having COPD and mild left ventricular failure. So it's not her best interest to discharge her now.
What are you concerned about more? Is it the axillary swelling or the shortness of breath?
Both, because there might be some reactionary hemorrhage as there is axillary swelling, and the shortness of the breath indicates that she could have presence of deep vein thrombosis or pulmonary embolism.
Okay, so what is your main concern at the moment? Axillary swelling or shortness of breath?
Both.
In a patient on the second post-op day of mastectomy, we'll probably do expect some kind of swelling, isn't it?
But there could be reactionary hemorrhage that might require later on evacuation, and also she is having shortness of breath.
Okay, so what you have, what is the daughter concerned about? Why she wants to take her home?
Oh, probably she's not she's taking her home because that is more convenient for her, probably, but
Yeah.
it's far away, and so I think it's not good for her best interest.
Do you think this patient has capacity to make her decision?
Yes, I think.
What does the
Yes, she
patient
has
want?
Sorry?
What patient wants? Does she want to get home?
But she's convinced that she wants to go home.
So patient wants to get home, daughter wants to take her home, but you think they shouldn't be going home. Am I right?
Yes.
Okay.
But
so how we are going to manage it? What are your thoughts about it?
For hemorrhage, I think I will do the full blood count to check whether there is a continued bleeding or present or not. And for the shortness of breathing, I like to arrange a CT pulmonary angiogram to see whether there is any DVT or pulmonary embolism. And if so, I will manage accordingly.
Okay, so that's what we want to do. But have you told the patient's daughter that this is what we want to do? If she's still
Yes, I have tried to convince her, but she is not convinced. So I have to inform her daughter about the possible complications that might occur if due to this premature discharge. And also I like to inform them about the legal documentation that they have to sign, that they will carry the full responsibility due to this discharge. And also I will inform them about the sign and symptoms when they have to contact immediately, like increasing the wound discharge or becoming more unwell, or she's having more shortness of breathing. Shows they have to seek advice immediately nearby hospital or here.
Okay, what else? What else can happen?
Sorry?
What else can happen if she goes home? She can bleed to death. Can she?
Yes.
Yes. And
yes.
Anything else?
No.
Ask
So
about the drain.
the question,
It was not mentioned about
Yeah,
in the,
It's not
that's
mentioned.
why I didn't, yeah, it was not mentioned,
Yeah.
so that's why I didn't, yeah.
right. So in a pulmonary embolism patient, what else can happen? If you're suspecting a pulmonary embolism, what other complications you'll be worried about if she goes home?
Emboli, thromboemboli,
Yeah.
and
So
death.
the emboli can cause what?
Death.
How? So it can cause a TIA, stroke, heart attack. Did you mention all this to
Yes.
the daughter? Good. Okay, so it sounds like she's a difficult patient and difficult daughter to talk to. Have you escalated it to the high people who do the, have you told them about a discharge against medical advice?
Yes, I will, legal documentation they have to sign regarding this discharge against medical advice, yes.
Fair enough. Sounds like you have done all the right things. Make sure you document everything. And is there anything else you want me to do?
No, sir, thank you.
Okay, thank you, bye.
Thank you. You still had 1 minute. You could have summarized the whole thing to the consultant. Yeah.
Madam, when I should summarize the whole thing at last? I mean,
Yes,
after
at the end, when the consultant says, okay, everything is done all right. If anything changes or anything else happens, inform me. Then you sum it up. Okay, before I leave, I want to sum it up for you what we have discussed so far. And then you have to tell in last 1 second or 1 minute.
again the whole thing. Again
Yes.
the whole thing.
Yeah.
Okay.
Whatever has been discussed and finalized between you and the consultant, you have to tell. So both of you are on the same page.
Okay, ma'am.
Yeah. So still had 2 seconds. You can maybe. All right. Very good. Who would want to begin and give the feedback? Dr. Ishfaq, would you want to give the feedback, please?
Yes, ma'am. Right. Everything has been done on time. So with time, she will get better. And the consultant was so good.
Yeah.
And angry as well.
Typical consultant. Yes. Very good.
Typical
Yes.
consultant. If one gets like the consultant, this one, there are chances he might get failed.
Oh, Lord. Yes, even consultants, it was her first time, you know. She has.
No, it was great.
Yeah,
it was great.
so no bellman. Okay, it was good. Yes, her performance was also good. Yes, very good. Anyone else want to give any feedback? I think it's getting better, Dr. Farah.
Okay, ma'am. Thank you.
No.
Yeah, they all enjoyed Dr. Wajia. They say the consultant was classic, so that's good. And I don't know how you, Dr. Abhishek, would you want to give feedback, please?
No, actually, ma'am, I was just saying the consultant was very sharp in this case. Like she was asking everything about this, but the fact is, whenever he or she asks you something about anything else, you never ever guess that it's not something else. There must be something else. Okay, so he was she was asking about what may be the consequence of pulmonary embolism. So pulmonary embolism, what does it cause? Actually, it will cause the respiratory failure and eventually death. You can mention about that. So think easier, you will get a easier answer, trust me. That's my feedback.
Yeah, but like it was good the way she asked, because one should know what question to expect next. Anything can happen, and once you're mentioning the complications, then you should be able to tell the sequence, how things evolve and how things get worse. So then you should be able to be in a position to explain. It was good, very good. Yes, it was random for these girls. They didn't know which station I'm going to have, so it's good. Yes, Dr. Dio, do you want to say something? No? Okay. All right, let's move. Yes, would you want to give feedback?
Yeah, it's just about the simulator. Actually, I think she acted really good. I mean,
Yes.
as a consultant, and that's what classically happens. So yeah, it went really well.
Yeah.
The candidate as well, I think she maintained her cool in most part of the conversation, and
Yes.
yeah, that was really good. She wasn't easily developed. So yeah, that was nice.
Yeah. Good. Thank you. Very positive. That's good. Yes. And very thoughtful from another angle. Very good. Yes. Right. Should we move on?